Hello, I'm Angela Stepp, Director of Communications for WSOT TV and Sunnycrest Baptist Church. Momentarily, Grant County leadership will be sharing a community update with information regarding the current COVID-19 outbreak. This community update will be rebroadcast today at 5:30 p.m. and 10:30 p.m. here on WSOT TV, and again on Sunday, April the 5th at 10 a.m. and 5:30 p.m. It will also be made available for distribution online and through various local media outlets. And we do ask that you please help share this information with your family and friends. Joining us today will be Bob Jackson, Grant County EMA Director, Mark Bardsley, Grant County Commissioner, Mayor Bill Rock of Gas City, Chief Paul David of the Marion Fire Department, Dr. Brad Lindsay, Superintendent of Marion Community Schools, Jeff Edwards, Director of Transportation for the City of Marion, and we will also hear from Marion General Hospital Representative Sarah Evans, also Dr. David Moore from the Grant County Health Department, and Public Health Nurse Amber Turner. First, you are going to hear from Grant County EMA Director Bob Jackson.
Thank you, Angela. Good afternoon, Grant County. We'll spend a little time. We'll bring you up to speed and give you an update as where we are in planning from the emergency management side of things and some of the things that we're supporting throughout the county in preparation of a spike that we're still expecting. So we get our information from the Indiana State Department of Health, and they partner along with the federal partners and all that. That's where we get fed our information, and we make the best decisions that we can make based on the information at hand. And we look at it every day, literally every morning. A group of first responders and different organizations from throughout the county and the communities, and plan for what we know to be our best information. So locally, the health department, along with Marion General Hospital, have been the lead agencies from the very beginning, and that has not changed. All of the other emergency response organizations, and really some of our private and public partners as well, all of our efforts are in support of Grant County Health Department and Marion General. They are truly the folks on the front line that we want to support. So, with that, lots of other things go on, and we are making progress. I know I reported last week that PPE, personal protective equipment, was in short supply for our first responders. It is still somewhat short supply for our healthcare workers, which we absolutely want to get them the best that we can get. Those are the people that take care of you, and we really need for them to have the best that they can have. We are making progress there. Marion General Hospital has taken a lead with different ways that we can acquire that equipment outside the normal means. So we're doing some things. We have local industry that has partnered with us and has stepped up in a big way. Tim Eckerly, Grant County Economic Growth Council, absolutely been instrumental in helping us do that. So lots of people chipping in and really rolling up shirt sleeves and going to work for us. The other thing is food distributions, doing very well. I know that Marion Community Schools is doing theirs this afternoon. I think Second Harvest is due for another one on Friday, April 4th. So there again, those efforts going very well, and we want to support them. With the long-term care facilities, which truly is our most vulnerable population that we absolutely need to take care of and watch out for, was in a meeting yesterday, and Marion General may speak to this some. They help bring those folks together, but making sure that we have a plan to deal with those folks, and they do, working on it every day. So lots of people doing lots of good things. I guess the bottom line, I want to leave you with this. All of our best efforts, everything that we can do, our police officers, our firefighters, EMS folks out in the field, we can't protect you from this. You have to do that yourself, and it's relatively easy, honestly. Just stay away from people. If you keep your distance, it will take a few more weeks that we're looking at now, potentially, but that is truly the best thing that you can do for yourself for the healthcare workers that we are desperately trying to support. It seems too simple, but honestly, that is the best thing that we can do at this point. Stay away from people. Use your social distancing that you're all getting very good at, and we should be practicing well by now. So, honestly, the best thing that we can do. So I will leave you with that. And thank you, Angela.
Thank you so much. And next we will hear from Grant County Commissioner Mark Bardsley.
Thank you, Angela. Again, thank you for the opportunity to Sunnycrest Baptist and this TV station for allowing us to update you on concerns of the county. Just a reminder that the Grant County Complex building is closed to the public till further notice. Sheriff's Department and the courts, probation, all are limited access due to the ongoing pandemic. We do apologize for the inconvenience, and if you have questions, you can call in at this following number, 668-8871, 668-8871, and you can get department information, or you can go to www.grantcounty.net, and you'll be able to look at the different departments and forms that you may be needing. I will let you know that the property tax schedule is still going out. Your tax forms will be getting to you, reference property taxes, and that cycle is still ongoing. You should see those coming to you in the mail in the next couple of weeks. I want you to know from the county perspective, I believe that we are in fact seeing positive results with our continued vigilance regarding the social distancing. I cannot emphasize enough, Grant County citizens do need to stay sheltered in place in order to mitigate this pandemic spread. I don't know if you got to watch the press conference with the president this past Sunday, but they shared with us what this pandemic would look like with mitigation and without. If we didn't do anything, they are saying that the models would say 2 million people would be fatalities because of the spread of this virus. But with what we are doing with the social distancing and the staying at home policy, that brings the number down to right at 200,000 people. And so we are pleading with you as citizens of this county to make sure that we continue at social distancing, making sure that we step back and we take this time to encourage one another. With regard to foods and supplies, most stores, as you are aware, will be limiting certain things because there's such a great demand. And again, we ask for your thoughtful consideration as you go to the stores, as you go to these places of essential services, that you take what you need, but you don't take more than what you need, because there are folks that need that type of support too. Been asked also to make sure that we do not use stores as social gathering places. Some folks have been doing that, and we want to emphasize that if we do that, we are continuing to cross-contaminate. We need to stay away from one another. Please do not put others at risk because of the desire just to go out and talk to people. You can do that via internet. You can do that on your phone. Make sure that you are giving proper distance in that area. I do want to thank those who continue to have their takeout and drive-thrus open. That is helping, and we encourage folks to continue to do that. Take a breath, go out, get a drive-thru meal, and go home and enjoy that. Thanks to our local businesses for allowing that to happen, and as well for those who are retooling and helping this effort. We even have church groups and ladies and gentlemen that are sewing for some of the protective equipment that our folks need. And we say thank you again for that. One more item, just a quick thought about staying at home. Some of you remember in the Old Testament book of Isaiah, it says, "But they that wait upon the Lord will renew their strength. They will mount up with wings as eagles. They shall run and not be weary. They shall walk and not faint." And as we think about sheltering in place, as we think about having to wait for a little while, I really want to know what that word wait means. And it's really kind of neat as you look back into it. It literally means to look, being observant wherever you're waiting, to tarry with patience, and then you will have the result that you're waiting on. We're waiting in place. We're staying socially distant. And I think that if we wait with that anticipation and expectation, there'll be a day when we can run, we can walk, we can enjoy life again, we can socially get together and enjoy one another, but for just a little while longer, at least through April 6th, according to the governor, and the president's asking for us to shelter in place till April 30th. So we'll see what the governor has to say about that, because each state does have to decide that for themselves. So as soon as that information comes to us from the governor, we'll get that out to you as well. But thank you for your time, and again, stay home, shelter in place, use social distancing when you have to be out, and Grant County will get through this. Thank you very much.
Thank you, Commissioner Bardsley. Very important information. Next, we will hear from Mayor Bill Rock of Gas City.
Thank you, and I'll try not to be redundant on what people have talked about on the virus, but as of this morning, as you probably already know, there have been 9 confirmed. So the single most important thing that anyone can do in a type of crisis, corona-related or otherwise, is to focus on what's in our control. We can't control what happens in the future. We can't control the coronavirus itself, but we can control what we do here and now, and that matters. In order of keeping this infection from spreading, we need to stay home and follow the CDC recommendations. Only travel for essential products and services. That's very important. If you feel sick, stay home. If you're an older person, stay home. If you're going to go out to eat, make sure you please support your local restaurants that have been shut down to non-essential or to essential only, but use the carry out or drive up. They probably need your help now more than they ever have before. And always practice good hygiene. I know you've heard this over and over. Wash your hands, disinfect frequently, and surfaces as much as possible. Now, at the same time, we don't want to encourage people to get into a panic mode. There are people out there who will help. Please take the safety precautions and tips. Even if you are young or otherwise healthy, you are at risk. And it is critical because you can spread this to your grandparents or parents or somebody that may be compromised in health. So it's very important that the young people stay home too. It's only for a couple more weeks. We should have this virus under control, but we don't want to let it grow. It's time for us all to recognize the magnitude of this infection and work together as only Gas City and Grant County can to help ensure it goes no farther. We need to follow the Indiana Department of Health and CD's guidelines. I hope there's something in this statement that can help you. These are crazy times, so please do treat yourself kindly. And remember the words of Winston Churchill, when you're going through hell, keep on going. Thank you for your help, your patience, and together we'll get through this as a community and a city. Thank you.
Thank you, Mayor. We really appreciate hearing from you. And next we will hear from Jeff Edwards. He is the Transportation Director for the City of Marion.
Good afternoon. I'm here to talk about the city buses. We are running approximately 4 buses a day, call-ins. We are 24 hours in advance. If you call in, we'll fit you in to take you to the doctor, to the grocery store, and to work. Those are the only 3 places, and the pharmacy. So our bus drivers are working real hard to keep the buses clean. We sanitize them before they go out. We sanitize them after each person leaves the bus, and so they're very clean. We wear masks. We have gloves. We're doing everything to be safe and make everybody else safe. So if you have any questions, you can call the terminal. It's 668-4445, and we will take care of those questions. And if you need a ride or you need to go to the doctor, the pharmacy, the grocery store, please call, because I think we have the safest buses, clean buses, and we'll get you where you need to go. Thank you, and stay safe.
Thank you very much. It's comforting to know that there are still transportation options available here within the city of Marion. Next, we will hear from Chief Paul David of the Marion Fire Department.
Hello, Marion and Grant County area. I'm Paul David, the fire chief for the city of Marion. We just wanted to kind of go over a few things with you, and maybe you've heard some of the other persons talk about it. One of them that was key was listening to Mark Bardsley about his shelter-in-place deal. We're obviously trying to prevent the spread of this, and sheltering in place is a great idea. Couldn't imagine where we'd be if we didn't take some of the precautions we have now. One thing I want to reassure you is that the fire department services are still being done, and wanted to go over a few tips for persons that we may be responding to. If there's a person in the house along with the patient that we get called to, and that patient is suffering flu-like symptoms, it would be great if we were notified prior to entering the house, and if at all possible, if that patient could make it outside for treatment. We're trying to protect our first responders as much as possible and deliver the level of care that we've always delivered to the citizens. We also want to remind everybody to wash your hands for at least 20 seconds. Proteins and fat is what this virus is made of. It does not have to be antibacterial soap, just to let you know. So if that's off the shelf, regular soap works, and what you're trying to do is break up the fat in the virus. Once that's done, and it can only be accomplished by at least 20 seconds of thorough washing, you have then eliminated the germ from you. Again, we're providing the best level of care we can with every precaution we can. When we arrive on scene now for ambulance assist, our firefighters may look a little different. We're going to be in Tyvek suits and also taking all the necessary precautions that we have to protect our first responders. We just ask for cooperation through this ordeal that we're going through, and early notification to us will help us preserve those first responders to be able to render care to someone else in the community that may need it. Thank you.
Thank you, Chief David. And next we will hear from Dr. Brad Lindsay of Marion Community Schools. He is the superintendent.
Thank you, Angela. Hello, community. I want to thank you for loving one another. The more we love one another, the less we fear. Love more and fear less. I want you to know that I'm very thankful for the leadership of Commissioner Bardsley and Bob Jackson from Emergency Management, as well as Dr. Moore and Amber Turner. They're working tirelessly at all times. They're staying alert. They're staying apprised of all information. They're working proactively on our behalf. They are speaking the truth. We can trust them, and we have a team activated to help all of us. I want to thank them. As you know, the governor has closed school. As we do our part to fight this global pandemic, please check your school's websites for important information. Please check those daily. Students and parents, please connect with your principals, teachers, and social workers, and we will reach out to you as well. Home learning enrichment opportunities are posted on school websites. Please contact teachers for any help that you want. In Marion, Wednesdays from 4 to 6 is our food distribution. Thank you for helping us get food to our families. Community, please be safe. Please keep caring for one another and loving for one another. Community, we're in this fight together, and when our community fights, we will win. Thank you.
Thank you, Dr. Lindsay. And next we invite Sarah Evans from Marion General Hospital to share with us.
Thank you very much. I just want to share a little bit about Marion General Hospital and that we continue to be actively engaged in the Grant County Emergency Operations Center in planning and preparations for concerns related to COVID-19. MGH has had an emergency operations plan in place, but this is a different type of response that we're planning for, and this plan is evolving as we learn more about the safest ways to meet the needs of our community. As you may be aware, Marion General Hospital is licensed as a 99-bed facility. Within the planning for a possible surge of patients that require hospital-level services, MGH is working to explore a variety of options of how we would meet the needs of those patients, not just within our facilities, but also within places within our community to best meet all of the needs of those individuals. Indiana has 10 public health preparedness districts throughout the state, and Grant County is a part of the District 6. The counties within the district are in contact on a regular basis to understand the needs and resources available in each county. MGH is also a member of an organization called Suburban Health Organization, and we're working with those member hospitals to be able to share resources across our organizations. Additionally, MGH is receiving information on a consistent basis from the State Department of Health and the Indiana Hospital Association. All hospitals in the state of Indiana are required to report on a daily basis what resources they have available to the state. As was previously mentioned by Bob Jackson, we've been working with all healthcare entities and providers within the local community to work together to ensure that the hospital is in the best position possible to take care of the sickest of individuals in our community with COVID or other high-level hospital needs. We recently acquired a UV light that provides us the opportunity to decontaminate our N95 masks and help reuse them to conserve our stock of PPE. We'd like to share that approximately 150 individuals have had specimens collected for COVID-19 testing at our Marion General Hospital facilities. Over half of those samples have been resulted and the results provided to the patients. The majority of those specimens have been collected on outpatients who were able to isolate at home and manage their symptoms. A small amount of those individuals required hospitalization. We are pleased to share that we have had hospitalized patients that have recovered and been discharged to their home. Again, we want to remind the community that if you have questions or concerns about symptoms you may be experiencing, to please call the respiratory call center number. It is available 24/7 and staffed by our medical nursing staff. That number is 765-660-6999. We'd also like to share that the outpouring of community support has been amazing. We feel truly blessed by those who have donated, provided resources, and explored ways to assist us with meeting the requirements for PPE. The first prayer vigil was held last evening, and our staff were overwhelmed with emotion from the love and support they felt from our community. As you can imagine, this is a very challenging time for our staff members, both physically, mentally, emotionally, and spiritually. There will be another prayer vigil held this evening in the parking lot of our 330 building at 6 o'clock. During Holy Week next week, there will also be prayer vigils held on a daily basis from 6:30 to 7:30 p.m. These are being organized by local faith organizations as well as our local pastor within the hospital for pastoral services, Pastor Horseman. We ask that those participating stay in their vehicles to maintain social distancing, but we appreciate the support and the prayers as we work together as a community to overcome this pandemic. We know that social distancing is our best defense against the spread of COVID-19, and we just want to thank you all so much for your kind words, the appreciation to our staff, and how the community has been committed to us as an organization, and reassuring that we are here to continue to meet your needs. Thank you.
Thank you, Sarah. And next we will hear from Dr. David Moore from the Grant County Health Department, as well as Public Health Nurse Amber Turner. Welcome you both.
Thank you. I'm here. I'm Dr. David Moore. I'm the County Public Health Officer since the beginning of my second year in that position. I'm an obstetrician, gynecologist here in town. Been here for 25 years and had the opportunity to look to serve the community in the position of Public Health Officer. A new position for me and a great learning position. It was a relatively simple position, not unimportant, but relatively simple position until COVID-19 hit the community. And I have been amazed and impressed at how our community has come together. This is a once-in-a-lifetime event. I have never in my entire career seen anything like what COVID has done to our community. And I have been so impressed at the same time of how the people here in Grant County and in Indiana have responded to this. There have been some things that might have been able to do better, and if we knew them, we would have done them better. But the people performing to the best of their ability to respond to this challenge, and I have been amazed by it. Bob Jackson, who is the head of our emergency management agency, has helped pull together a team. He asked us as the health department to comment on the medical aspects of it. Our big partner in the community, of course, is Marion General Hospital. Yesterday, we had a briefing with the CEO, and we said, listen to what, as Sarah had talked about the plans that we have and the in-depth year by year by year plans that they've had for how to deal with this, so that maybe we may not meet that same emergency that they planned for, but what we've learned is how do you respond to an emergency? How do you call the resources together? How do you come together as a team to be able to deal with it? And I've been amazed and impressed. We have 99 beds in our community. We have a number of intensive care beds. We have an operating room and other facilities there. How they've been repurposed, sometimes being used, but sometimes a plan being made to use them. And I have been just amazingly impressed at how our community has been ready to deal with this crisis. Our job as the Public Health Department is to see where we can coordinate where we can, but also to be the source of information that is there. And so that our commitment to you is that we will honestly and openly report about what we have. The fear and panic comes because we have a big thing that we haven't seen in our lifetime before, but we also have a big response of a community that's come to meet them. And for our public to be aware that we as a community, we as a health department have been aware of and taking care of and responding to those things. Our commitment also is to be transparent and forthcoming so that if we know, that you will know with that. There are some things that we don't know. There's maybe some things that we do that it isn't, maybe we learn later isn't the best way to do it, that we will do the best that we can with what we know and that we'll be honest with you about what goes on. The health department it gets reports from the state, and that is the collector of those results from coronavirus, COVID-19. That there may be other things that look like the coronavirus, and that a clinician, a doctor, a nurse practitioner may say that I think that this looks like. And then we confirm that by taking a test. And if the test comes back and the clinician is not sure about that, they may even submit another test. We can't call that until we get a test result that confirms that. And we can confirm those that live in Grant County, and that as we know them, that you'll be notified of them. The people who do have positive test results, our next job is to find out who have you been in contact with. This is spread by droplets. It doesn't hang in the air. Once a droplet hits the ground, and if it hits another surface, within a few hours, it'll be gone. So this isn't like other viruses that the virus floats in the air. It goes by droplet spread that's there. So that we find out who are the people that have been in contact with this known infection person, and we get in touch with them, let them be aware. We're not going to disclose the confidentiality of who it is, who it was that had the infection. That's their private information to know. But as it impacts the public health, it is our job to get in touch with them and to get in touch with the people who might have been affected and to effectively let them know what it is, to provide a plan. We've heard over and over again about isolation, social isolation. someone told me that what we're really looking for is physical isolation and not social isolation. We want to be in touch with one another. We want to touch and protect one another, but we want to keep a physical distance so that that droplet spread doesn't occur. To also to help people to understand what does it mean to be on isolation, not just the importance of it. It is very important. What does that mean? And what are the resources that are there? And our commitment to you is to be aware of it, to be responsible in it, to be transparent, to be both forthcoming and transparent to you. We'll get through this. We'll get through it together. Thank you. Amber?
Thank you. I'm Amber Turner. I'm the Grant County Public Health Nurse. We have other divisions in our health department besides the nursing division, and the foods also wants to keep our restaurants and bars and other establishments aware of changes that they are having as well. So the food division would like to let restaurants and bars know that the latest executive order means to the establishment. Governor's Executive Order 20-04 prohibiting restaurants, bars, nightclubs, and other establishments from providing in-dine services and close-in-person patrons. However, these establishments are authorized to continue to provide drive-through, takeout, and delivery services. In addition to the directives in the Executive Order 20-04, located under paragraph 6, that is new, I further order that the prohibition on dining and in-person patrons and in-dining services encompasses all portions of the premises of the dining establishment, including not only interior areas, but also patios, areas of outside eating, and parking lots. And into addition to Dr. Moore's with this COVID-19 on the nursing side of it, I know that there has been a lag as far as the state having their number of cases that we have in the county. They go through those through midnight, so anything that's posted after midnight, if it be early in the morning, may not reflect on that map. The office manager verified that with the Indiana State Department of Health. So we were reporting 8, the map still said 7, but we did have 8. So when we get those positives, the numbers that we have and that we say are the numbers that we can see on our database that we get directly from the state, electronically reported to us, and we check those all throughout the day, several times. So the number on the map may be different than the number that we report. And they have been made aware of that. It is updated now, and we do have 9 confirmed cases in our county. So if we say a different number that's on the map, it's because we have seen it on our end. It may just not have been reflected on the map. So there is a reporting system that we have to follow. So we hope that you will be patient with us and that you will understand that the numbers that we do give are the numbers that we are seeing that are directly reported to us from the Indiana State Department of Health. Thank you.
Thank you.
Thank you both. Important information. That's why we do this public service announcement. As we conclude today's community update, I would like to remind you that it will be rebroadcast again today, April 1st, 2020 at 5:30 p.m. and again at 10:30 p.m. here on WSOT TV. Also on Sunday, April the 5th at 10 a.m. and at 5:30 p.m. And would like to extend a great big thank you to our local media for your coverage. And this concludes today's update. We now return to our regularly scheduled programming.